Okay. Hello, everyone. Good afternoon. My name is Rodney Vassallo. I'm the course admissions tutor for diagnostic radiography. Thank you for joining us today. I am joined as well by one of our students, Manali, who will also be giving her experience later on about being a student diagnostic radiographer at St. George's University, and you'll be able to ask her any questions as well. So I'm going to start this talk today. Okay, just a second. Hopefully you can see my screen. Bear with me. Okay, so hopefully you'll be able to see my screen there. This talk is divided into two sections. Okay, in the first part, we're going to talk about diagnostic radiography as a profession, and in the second part, I'm going to talk specifically about diagnostic radiography at St. George's University. Okay, also want to say if you do have any questions, please write them in the chat, and then we'll be able to. I'll be able to go through them and answer them at the end of this talk. Okay, there'll be time for questions, so don't worry about that. Okay. Okay. So first of all, who is the diagnostic radiographer? Okay. So diagnostic radiographers, we as diagnostic radiographers. We take images of most of the time, often using radiation. So we use specialized equipment that involves radiation. So we're giving radiation to the patients, okay, to produce images that will help us diagnose injury or disease, okay. So as the name implies, diagnostic radiographer, diagnosis, to produce a diagnosis, the key word here, the key term is diagnostic, okay. So we're producing images so that we can use them, or scans, so that we can use them to achieve a diagnosis from them, okay. So this is slightly different to therapeutic radiography. Okay, so you might have heard of the term of the profession, therapeutic radiography, which is also a program which is available at St. George's University, and there is a talk about therapeutic radiography today as well later on. Okay, so please do join that one as well if you want to find out more. Okay, but as diagnostic radiographers, we're not actually treating any patients. Okay, we're using our equipment, and most of the time, not all the time, but our equipment uses radiation, okay, like I said, to produce an image that will help us produce a diagnosis. We're trying to find out what is wrong effectively with the patient. Maybe there's nothing wrong, but maybe there is a lesion, maybe there's a pathology, maybe there's something that's happening with the patient, and we're trying to find out what it is, okay, as opposed to therapeutic radiography, where in that profession, okay, they already know what is wrong with the patient, and in that case, therapeutic radiographers deal with cancer patients. So they are specifically dealing with patients who have cancer, and they are using radiation to kill those cancer cells. So they are providing a treatment in that case. Okay. In our case, we don't know whether the patient has cancer or whether they have a simple cough or a fracture or whatever the issue might be. Okay. So we are focused, our goal here is to produce a diagnosis, not to provide treatment. Okay. Obviously, as you can expect, we will be dealing with patients who are uncertain, unwell. Okay, so again, there's a wide range of patients that we're going to encounter. It could be you're going to have a patient who just walks in because they've had a cough for a few weeks, and the doctor might have asked them to go have a chest X-ray, for example, or it could be someone who's been in a serious road traffic accident, has multiple injuries, okay, or someone who's has had an injury of some sort, or an issue, a medical issue. Okay, so they might be worried, anxious. Okay, they might be in pain. Okay, so we have to use our skills and adapt our range of skills and adapt to the patients that we have. Okay, so obviously we have to make sure that we communicate with the patient and adapt our skills to the patient that we have in front of us and that we're dealing with. Okay. The other thing that radiographers do or have to do to fulfill their profession is to use our equipment. Okay, so we can't be radiographers without the use of our equipment. Okay, so unlike maybe other professions that can carry out their profession without the use of a lot of equipment or specific high-tech equipment, we cannot produce an X-ray without an X-ray tube or an X-ray machine. We cannot do a scan, a CT scan, without a CT scanner. Okay, so we're quite privileged in that sense that we get to use some of the most high-tech and expensive equipment that you can find in all of the hospital. Okay, because we need this equipment to be able to fulfill our role and produce our images. Okay. So as a radiographer, you will get to learn about all these different types of equipment as well. Okay. So in terms of examinations, you might ask, well, what does the radiographer do? Okay. So overall, you might associate radiographers with X-ray. So X-rays. So obviously, yes, we take X-rays as our main sort of bread and butter, if you like. The most common imaging modality is still X-ray. So about 50% of what we do is general X-rays. The X-rays that you do could be a chest X-ray, could be a hand X-ray, a knee X-ray, ankle X-ray, whatever. So one or two multiple images or single images of a body part or an area. Okay. But obviously, we don't just do X-rays. There are what we call other modalities, other pieces of equipment that we use to fulfill our role. Okay, so the next most common modality or piece of equipment that we use as radiographers is ultrasound. Okay, so after projection radiography, we call it general X-ray. Ultrasound is the next most common imaging modality. Okay, as you can see on the graph in front of me here, this pie chart, this is the number of examinations done between March 21 and 22 in all of the NHS organizations in the UK. Okay, after ultrasound, the next most common imaging modality is CT. Okay, so CT, as you can see, is quite important modality because we do a lot of CT scans. And then come the other modalities. We've got MRI, we've got fluoroscopy, and we've also got radionuclide imaging. Okay, so those are the main modalities. There are some other modalities which are not mentioned here, which would fall under uh, um, imaging as well, such as, for example, mammography. Okay. Okay, so again, these are some of the modalities that I've just mentioned. Okay, so as you can appreciate, okay, when we talk about X-ray, okay, yes, it's still X-ray, but even X-ray itself comes in a variety of forms. So as you can see in the top left-hand corner here, it could be just a patient, for example, who was jogging in the park and they've twisted their ankle. They've been to GP or they went to A&E and now they've come for an ankle X-ray. Or as you can see on the top right-hand corner, maybe someone who was involved in a road traffic accident. Okay, and as a newly qualified radiographer, this is what you're going to be doing or dealing with. Okay, and that's why, like I said earlier, you need to be familiar with the equipment, but also be able to deal with the variety of patients that you might get. Okay, you might be doing imaging, as you can see in the top middle picture here, on a mobile machine, for example, when we have patients who are too unwell to come to the imaging department, we go to them. So we've got mobile imaging X-ray machines that we utilize and do X-rays by the bedside, for example. Okay, and then apart from that, obviously there are the other imaging modalities. Like we said, you can see in the middle section we've got ultrasound, we've got CT on the left, MRI on the right, fluoroscopy bottom left hand corner. Okay, so again, that is used to produce fluoroscopic images. So if we compare X-rays as a one single image, okay, fluoroscopy is a continuous video of imaging. Okay, so if you compare X-rays to a single projection, one image like a picture, fluoroscopy is like taking a video. Okay, so in an X-ray mode. Okay. And that is also done, for example, in a theater environment. So as a newly qualified radiographer, you might be doing X-rays during a surgical procedure or orthopedic procedure in a theater environment. Okay. And then obviously we've also got RNI, which is the middle bottom image there, and mammography on the bottom right hand corner. Okay, so as a newly qualified radiographer, you could be working in multiple areas, not necessarily all these advanced areas. Okay, but definitely in the terms of X-rays in all its multiple setting, fluoroscopy, and even some CT. Okay, but the other modalities will require some specialist training. Okay, and you'll have to do that later on after you qualify. Okay. So you might think, why would I want to do diagnostic radiography? Well, if you want to have an important role in the terms of the patient's well-being healthcare pathway, okay, then diagnostic radiography would be ideal, okay, because when a patient first goes into hospital, okay, with an issue, with an injury, with a pathology, okay, we as diagnostic radiographers, we're among the first people to see that the patient comes to us to see first. And that's because if a patient has come in with an injury, okay, after they're going to be seen by a specialist nurse or a doctor, what the clinician wants to know sooner rather than later is the extent of that injury, okay, and how are they going to find that out? By sending them to have some imaging done that a radiographer can do, whether it's an x-ray, whether it's a scan, okay, whatever it is. So most of the time, we're going to be the first people that we encounter along that the patient encounters in terms of healthcare professionals, that the patient encounters in their care pathway. Okay, and obviously we don't work in isolation as well. Okay, we work alongside a variety of people. Okay, so we work in a multidisciplinary team. Okay, very often it could be that you could be working on your own, seeing patients in your X-ray room. Okay, but most of the time you're also going to be getting patients from different areas. So patients might be accompanied by nurses, by doctors. Okay, especially if you're working in a theater environment, for example, if you're doing CT scans, MRIs. Okay, there's going to be a variety of other healthcare professionals going to be working it with. You need to have an interest in human anatomy, physiology, and pathology, of course. So, obviously, as diagnostic radiographers, you need to have a good understanding of the human anatomy, the physiology, and the pathology, because we need to know, obviously, what normal looks like to be able to identify what's abnormal. So, as radiographers, we need to have a very good understanding of human anatomy and the physiology as well. Okay, and also you need to have an interest in science and technology, because like I said, we cannot do our profession without the equipment, and part of being a professional is understanding how that equipment works. Okay, so as a diagnostic radiographer, you need to have a good understanding of the equipment that you're using, because you're going to need to utilize it efficiently and adapt your technique to the patient that you have in front of you. And you can't do that if you don't have a good understanding of the equipment that you are using. Okay. In terms of skills that are ideal that diagnostic radiographers need, I would say obviously you've got core skills such as communication, caring, compassion, etc. Okay, like I said, a good interest in science and technology and being able to work independently. Okay, and obviously skills related to the workplace such as team working, reliability, flexibility, adaptability adaptability and remaining calm under pressure are probably two of the most important skills that a radiographer could have. Okay, because although we learn how to do things and different scans and projections in a textbook way, okay, most of the time when patients come to see us, okay, we also often have to adapt our technique. Okay, so being able to adapt the situation and the patient you have in front of you is a very good skill that radiographers have and get over time. Okay, and obviously remaining calm under pressure. Sometimes it's a stressful situation. Okay, especially if the patient is critically ill with several injuries. Okay, you need to be able to do what you need to do, carry out the examination, adapt, and remain obviously calm under pressure. Okay, one important thing to consider if you're considering doing obviously diagnostic radiography is to ask yourself, what do you want to achieve? What do I want from my career? Okay, and as you can see here, this question was asked to a series of qualified radiographers, okay, and to see sort of which career attributes in terms of their expectation from a career radiography was important to them, okay. And as you can see, most of them said that they were after job satisfaction, enjoyment, job security, okay, a fair salary, okay. So yes, obviously, as a diagnostic radiographer, you're expected to get a fair salary, okay. And as I'll talk in a second, there's a good career progression, which obviously that will improve obviously the pay and the salary for that. Okay, but obviously if you're after, for example, a job which is going to give you a six-figure salary, then obviously diagnostic radiography is not for you, because you can't obviously achieve that. You have to make sure that you can meet your expectations. Okay, so it's important to ask yourself this question if you're not sure that diagnostic radiography is the job for you. Okay. In terms of what you can achieve as a diagnostic radiographer, okay, there are a lot of opportunities. Okay, so apart from the fact that as a diagnostic radiographer, you're going to be working in all the different modalities that I mentioned previously, so not just doing x-rays, okay, you've got the opportunity to advance your career. Okay, so you could specialize in any of the modalities that we have, for example, CT, MRI, mammography. Okay, you could specialize in ultrasound, so become effectively what is known as a sonographer, to be able to do the ultrasound scans yourself. Okay, and you could specialize obviously in other areas such as IT, or become a clinic application specialist. Okay, and as you can see there, you'll be moving up from across the career framework. So as a newly qualified radiographer, you start at the practitioner level, okay, and then you can go to an advanced practitioner or even consultant radiographer. Okay, so obviously I'm biased because I am a diagnostic radiographer myself, but I feel that diagnostic radiography provides you with a lot of avenues to progress your career, if that's what you wish to do. So, okay, so if you want to further your education and say, okay, I really like CT, I really like ultrasound, I would like to specialize in that, you've got the opportunity to do so. Okay. Now, moving on to the second part of this talk, okay. First of all, why should you choose St. George's University? Okay, so if we look obviously a bit at the in terms of diagnostic radiography, okay, these are the university rankings from the Daily Mail University Guide for this year, okay, and St. George's University as a university has ranked 6 overall in London, okay, but out of the 6 universities that are there, okay, that St. George's University is the only one that actually provides diagnostic radiography. So we're actually ranked the #1 provider for diagnostic radiography in London. So again, everyone likes a bit of statistics and tables. So again, this might influence your decision. It might not, but again, it's just something to consider. Okay. Now, what's it like studying diagnostic radiography at St. George's? Obviously, we've got a very friendly team. We've got a variety of lecturers, and we've all have got our own expertise. Okay, so we have we're a variety range of staff that we have specialization in CT, MRI, interventional. We've got reporting radiographers. We've got a sonographer. So we will try and convey our expertise so that we can distribute that to our students, okay, our specialities. So we obviously aim to provide high quality teaching. Okay, we've got good strong relationships with other health disciplines. Okay, and we continuously review our program for relevance. Okay, we look always at student feedback year on year. Okay, and update our modules, our assessments. Okay, based on the feedback that we have as well. Okay. Um, in terms of teaching and learning, there's a lot of opportunities for students with excellent resources. Okay, we've got a very good library, and there's good opportunities for student self-development. Okay. We utilize a range of assessment strategies, so it's not just written exams. We've got clinical exams, we've got submission assessments, submissions, reports, and a variety of approaches, essentially, including hands-on. Okay, so one thing about radiography, as I'll come to in a minute, okay, it's a very hands-on profession. Okay, the best way to learn diagnostic radiography or to become a radiographer is by practicing. Okay, and even though you obviously need to learn the theory, okay, the practice is a very important aspect of diagnostic radiography, and I will talk about that in a minute. Okay. We've got a very good student support system. We provide personal tutor to all students, okay, straight from year one. We've got an academic skills development, clinical liaison tutors while on practice placements, okay, I'll talk about clinical in a minute, okay, and we also provide health and counseling services, and we also have specialized assessments for any students with disabilities or special support needs, okay. In terms of the entry requirements, okay, I won't spend too much time on this, okay, or you can find all the details of our entry criteria on our website, okay. Just a couple of things to point out. Obviously, you'd need to meet our both our GCSE level 2 and A level 3 requirements. Usually ask for a minimum of 3 Bs, okay, or equivalent, okay, based on the UCAS tariff points, okay. There is some leeway to that, okay, but we also accept students not just via A level. There are a lot of pathways through which you could apply, okay. So if you have an access diploma or a BTEC level 3 diploma or a previous degree even, okay, we get a lot of students that have previous degrees, have done a degree in something else, maybe that didn't work out, or they want to try something different, and now they decided to do diagnostic radiography, okay. So we do get quite a number of students that have already a previous university degree. If your application is successful, and obviously applications are already open via UCAS, so you can apply straight away. They will be open till about the end of January, okay? So you can apply straight away if you're interested. Once you apply, the application will be reviewed, and if your application is successful, okay, you will be invited for an interview, okay. We use multi-mini interviews, okay, so you'll be invited for an interview, and then if you're successful at the interview, then you'll be given a conditional offer. So a conditional offer based that you meet all the other criteria. If you have any outstanding grades, for example, if you're still waiting for A levels, and subject to the BS and the wage clearing and things like that. Okay, so again, not going to spend too much time on this. There's much more detail on our website, so please do check that out for the entry criteria. Okay, in terms of the course structure, okay, I already mentioned that radiography is a very hands-on profession. Okay, so in terms of the structure, it's divided about 50% academic and 50% clinical. Okay, so over the 3 years, half of the time you'll be at university, the other 50% of the time you'll be based at a clinical hospital, a real hospital, one of our sites, which I'll show you in a minute, and that we have, okay, in London and Greater London. Okay. So it's quite an intense course, okay? It's a full-time course, and this is quite an important point, actually, okay? So some students might have a part-time job or maybe other commitments that they need to consider, okay? Once you're on the course, you're expected that you attend sessions and you attend placement. So it is a full-time course, okay? So we often find that students who don't prioritize their degree, their university degree, in terms of attendance and showing commitment towards it, okay, they often struggle, okay, because it does take up, it is a full-time course, and you are expected. So obviously, if you want to have for example, a part-time job, that's fine, okay, but that shouldn't be your priority whilst you're on the course, okay. If you can't commit to the course, maybe because of financial issues or other commitments that you might have, it's better to wait until you're in a position where you can commit to the course on a full-time basis. Okay. Again, just to give you an overview of what year 1, year 2, and year 3 will look like. Okay, so like I said, about 50% academic, 50% clinical. So around half of the time, there'll be academic blocks and there'll be clinical blocks. So you'll be starting, for example, in year 1 at university. We'll get you ready so that after Christmas, then you go to clinical, and you'll be on clinical for a period of a few weeks, and then you come back to academic, and so on and so forth. Throughout the whole 3 years, you'll be spending time in university and time on your clinical placements, and you'll go from block to block. Okay, so overall, it's about 50-50. Okay. In terms of the academic education, obviously there are several modules in year 1 and year 2, year 3, covering these core themes that you have here, okay, including anatomy, physiology, the science and technology, communication, contemporary issues. So you'll be learning throughout the 3 years a variety of core themes, okay. Obviously, it's important that you complete the modules that are in year 1 to be able to progress in year 2, and then you complete the modules in year 2 to be able to progress in year 3, and so on and so forth. Okay, so you can't progress the year unless you are basically have completed all the modules. Okay. We also need to complete research, a piece of research work, okay, which is usually you propose it in year 2, and then you carry out the research in year 3, and to write an article, okay, because this is a BSc honors degree, and like any other BSc honors degree, you have to include research within it. Okay, so it's important that as diagnostic radiographers, we always show that we're carrying out with the most current research in terms of what's available out there. Okay. One thing which we're really proud of and we're happy to have, and which you don't necessarily find in all universities, is our X-ray simulation suite. So if you've attended one of our open days, you might have visited our X-ray simulation suite. So this is a fully fledged X-ray room, okay, with 2 X-ray tubes. We've even got mobile units and ultrasound machines in there, okay, that we use with our students. Okay, so like I said, radiography is a very hands-on profession. So even once you're at university, okay, it doesn't mean that the sessions are going to be all of them sitting down in a classroom. Okay, you will have a lot of sessions where you're actually practicing in our X-ray room. Okay, because that's, although you need to learn the theory, the practice is very important. Okay, so you'll be practicing in our X-ray room. We even carry out assessments there, so you have clinical examinations in our X-ray practical X-ray room. So that when you go to the real thing on your clinical placement, you've already experienced moving about the X-ray room and positioning a patient. Okay, so it's very good that we have this available to us, and this is purely for our students. We don't it's only a simulation room, so we don't obviously see X-ray any patients in here. It's not part of St. George's Hospital. It's purely part of the university and dedicated to us only as a simulation suite. Okay, we've also got some interactive simulation software that our students can use, again, to practice in their own time, to take an access from the library or any computer on site at the university. Okay, and it just gives, and again, the students opportunity to practice positioning and taking X-rays in a simulated software environment. Okay, as an addition to the simulation suite. Okay, so in terms of the clinical education, like I said, when you are on site, 50% of the time you're going to have to attend a clinical placement. So you'll be allocated a clinical placement site, okay? And we'll come and see you on site. So we're not going to send you to a hospital and leave you there by yourself. We'll actually come to visit you, okay? To make sure how you're getting on. If you'll be given a set of competencies and proficiencies that you have to meet. So we'll come to see you on site to see how you're getting on, okay? When you are on placement, okay? And in year 1 and year 2, you'll be allocated a hospital. And then in year 3, you'll be allocated another hospital. So you get to, over the 3 years, you'll get to experience 2 different hospitals. Okay. These are the placement sites that we have an agreement with. Okay, so you'll be allocated over the 3 years 2 of these sites. Okay, so in year 1 and year 2, you might, for example, be allocated to Kingston, and then in the second part, you might be allocated, for example, to St. George's. Okay. Unfortunately, you can't get to choose where to go. Okay, these are allocated by our placement team. Okay, and essentially it could be anyone. Okay, any one of these or any 2 of these over the 3 years. Okay. We also in year 3 have short specialist placement sites. Okay, again, these would be week-long sites, again, to get you to experience a different type of specialist hospital that you wouldn't have otherwise seen. For example, we've got Great Ormond's Hospital, we've got Royal Brompton, which is chest hospital, the neurology hospital, etc. Okay, so you get to experience at least 2 of these in year 3 as well. We all provide accommodation for students. Okay, so if you're looking for accommodation, as a first-year student, you're guaranteed university accommodation. Okay, and then obviously in year 2 and year 3, you're expected to make your own arrangements. But if accommodation is important for you, okay, if you apply as a first-year student, you're guaranteed to get it as well. Okay, and again, there's more details on the link included there. Okay, and finally, obviously, we've got the St. George's Students' Union, And we've got several sports clubs and societies, special interest groups that we encourage students to join in whilst at university. Obviously, being a university student is not just about studying. Student life is very important as well, that you take part in extracurricular activities. And there's lots of special interest groups and societies that you can join. Okay. So I've put in my details there. Again, if anyone has any questions, we'll take them on the chat. You can make a note of our email addresses there. So I'm the admissions tutor for diagnostic radiography, and that's my email. We also got an admissions officer that you can contact directly, so you can contact any of us on those email addresses, and then we'll be able to reply to any of your questions. Okay, and that was my talk. So I think I will pass over to Manal now to do her talk, and then we'll be able to take any questions at the end. I will also go through the chat as well. Don't forget to unmute, Manal. I think you're still unmuted. Let me mute myself. Maybe only one of us can speak at a time. I still can't hear you. It still looked like you're muted. Okay, no problem. Okay, we're just going to wait until Manal comes back, and then hopefully we'll be able to hear her. In the meantime, I'm going to start looking at the chat. If you have any questions, type them in your chat, and I'm going to go work my way through them, okay, and reply to each one, okay. Also, at the end of the stream, you can join there's a separate chat room for the healthcare edition. Okay, so if you're interested in diagnostic radiography, you can join when the stream ends. You can still ask questions. Just join the healthcare edition chat room, and you'll be able to ask further questions there as well. Okay, so it looks like Manal is having some issues rejoining. Okay, so in the meantime, please do ask any questions. I'm still here. Okay, and I'll be replying to the answers to the questions that you've asked here already. Okay. Okay, I'm just going to go off screen. Thank you all very much for attending. I'm still going to be here, okay, in the chat, okay, and the stream is still going to be running. If Manal managed to join her technical issues, then she'll be able to rejoin the stream. The stream will be running until 4:45, so you can stay in this chat, and then after that you can join the other chat, which is, like I said, the Healthcare Edition chat room, where you can ask further questions, and I'll be there as well. Okay, so thank you all very much. I'll be answering your questions now.